people, and good morning, and good afternoon, and good evening. It depends on day and day. Today we day for one hospital for Benin. And this hospital, we say that they do so many things, we say consign health issues. So today we deal with one of our brother, we say, we can ask him some question, we say concerning the matter of health issues. Because we know say today people they see and many problems there around every year. So the matter now, a lot of people they get worried. Who's we concern some kind of particular sickness too? People get worried. But we can't use this opportunity certainly. Look, we all can get this discussion with this our brother. So that I make us here today. We not people like say now let me go talking of things. I would like to make introduce this our brother. First of all, brother, the honorable doctor. Good evening, sir. Good evening. The most important thing is this man, na Enoma, to be precise, now being by a B. Obohia.
Where's the brother?
So people are not here, so I said, but how they go? I bet you will not make you tell us your day.
Okay, my name is Dr. Alari Enoma Edosa.
Not the small thing. So you say name that Dr. Alari Enoma Edosa. So Mr. Dr. Enoma Edosa, I don't add that to journalism. So as the matter they go, when you say a lot of people with concerning health issues, with concerning say person sick matter, and that fit the handle well.
Yeah.
And even with the way you put for force here, we don't see and say you are staff of the Nigeria Police Scottish Hospital. Not be just normal, say that normal treatment like that. You know, this one is an official person too. Not the small thing. So as the matter they go, you fit tell us some area of your work will concern this hospital matter.
Okay, as I talked earlier, as a doctor, I be a medical doctor, and majorly my work to take care of patients and sick people. Me, for one, I can't be a person who gets very special interest for public health enlightenment and programs, especially when it concerns those of our people where they villages.
This is a big matter. You can't leave town. You can't be say, now people will say they for village. This one has talk say, not be just you be doctor. You be like you will get hands more for humanitarian service. Because now people will be saying they do for those kind of matter. Now they get interest for people will be saying when they feel say they for remote area. And they get their matter for mind. So as the matter they go through, we don't say even way to do all this one, wahala day.
Yeah.
Different matter they happen. So nobody don't be saying if we talk come out. But if you tell us from few wahala, we'll be say they for inside this matter.
You say where if I understand what you try to talk now, I think I tell you some of the problems we as doctors for those states we still face. Well, as doctors, for me, in a person when I don't work for both the public sector and the private sector. So generally, even currently, I know some of the problems we they face as doctors, both for the private sector and for the public sector.
So, Dr. Enoma, so as we talk on the conscious, if you say many things they be say, if you be saying a wahala, if you be saying that this will be say at times as they do this work, we be say this will be say become a cross, we be say at times it will become obstacle. Or what you be say that if you say this one now, what you be saying the worry about, maybe especially when they concern some patients, we be say when I want to take care of. So if you tell us some few wahala we guide this job.
Thank you. Generally, challenge when we as doctors. So for me now, the person where I don't work for the public sector and the private as doctor, so I don't get experience with all these challenges. If you know now for Nigeria generally, brain drain are one thing where they affects the health sector for Nigeria, and so it affect us as doctors. So one of our major challenges as doctors for those states today now staffing. But before I talk this story, what I talk, and I would also like to appreciate our governor, Senator Mondo Gbowolo. Recently now, there's some employment where the former government do, where in become before in call say may the first suspend that. But as in come say and say really staffing are one thing when they affect the health sector. In don't give approval now for those people to call start work. Although it never still reach you, like they always say, the virtues will always ask for more. Because yes, but at least it better pass the way it fed be, the way in midterm, like those people joining the workforce. But then if the state government can also try to employ more persons, do massive employment into the health sector for those states, will also help well to help for that brain drain or the staffing issue where they affect the state. But another matter again when they affect us as doctors, we say, now the equipment, facilities. Sometimes as doctor, you will know what thing to do, but you need to do one test or you need to do one thing, or you need to put this patient on something, but then it's not there available. So you can't get challenges. So equipment and facilities are one thing. That's why if you watch now, I also want to use this opportunity to appreciate this our mama where they Edo Specialist Hospital, will be the CND for there, Dr. Mrs. Antonia Onjoko, because recently now she don't upgrade the intensive care units for that facility. Before now, Edo State government hospital none of them get the only intensive care unit we will get for government now UBTH will be federal government home. So but now Edo State government don't get hospital, we get standard intensive care unit, courtesy of her. And now, you know, so intensive care unit, they will take care of all those very critically ill patients. When be like say, they not just put them for normal hospital ward because they need special attention. They need to be on machines like ventilator and all those things. But then all those that one never still reach. We still need so many diagnostic tools like all those MRI machine and the rest for facilities too, in terms of equipment for Edo State. Also, another issue where we still dey face na infrastructures. Infrastructures for the state still dey, although this our governor don try because recently now, he don give approval for the renovation and upgrading of over 50 primary health care centers across the states. But then, like I dey talk, those primary health care centers for rural areas, yes, they go help to take care of most of our disease for rural areas. But then, if they also fit help to also upgrade and also provide staffing for the general hospitals for these rural areas so that the ones where the primary health care no fit handle, they go fit refer to the general hospitals. Go also help to also reduce some of all those deaths from preventable sickness where they keep people for villages. So this, at least, but with this renovation and upgrading of these 51 primary health care centers now for Edo State, where this our Oga when you come for the primary health care agency for Edo State, Dr. Cousin Lamire, don dey try in a renowned cardiothoracic surgeon wey don train for Nigeria and abroad. So he don bring him idea into the primary health care. Now he take make governor quick now wey they don give approval for this renovation of over 50 primary health care centers for Edo State. Another major issue why I know say they affect doctors again, well. Now this one are doctors wey dey public hospitals, mainly they affect. Carry those ones wey wan go specialize. There's this fund wey we call the Medical Residency Training Funds, MROTF. Now money wey government dey pay to those doctors wey wan go specialize for one particular part of medicine. Say, okay, you wan go be gynecologist, or you wan go be psychiatrist, or you wan go be just like that. So government dey pay that money every year to those doctors wey wan to encourage them, because the exams and the program, they pay money, they spend money put. So to encourage them so that more people will also go, and the nearest future those states will get more specialists. But currently, I know say doctors for the state never receive even the one for last year, talk less of this year. So now waiting, I go also want me those state government look into to pay them that money so that they will also feel encourage others. We see they look, say they want to enter this program, but they look and say, I get family challenges, I get all this my money, go fit take care of all these things, sponsor me through this program. When they know say that money they come and they come frequently, they go dey encouraged to enter the program. So these are some of the problems why I know say they affect doctors for both the public and the private sector for Edo State.
Not a small thing. If you be like say you don't almost talk about the matter finished. But the matter man be saying, as you're talking about just now, this one will be saying make us understand now concerning the state governor. What you be say, don't they try this period, don't be say it now, we say try to say they promote health issue. Because the like say the governor no say health matter, now what you be say very important for community, but with the As we talking about before, people will be say what they feel say they for those rural area. Will be saying Before you reach where they maybe motor self. You know, they reach there. Na keke. And they tell you who they reach there, business day. For the governor not to think, say, these people for that side, it is important because the environment too, wait for the take care of person. Now go determine that person will pay well or not. So and that's the same environment too. When I will be say if the doctor, will be say they take care of people too. If the environment they comfortable for now, you will see they feel comfortable for when the patients will be say when they take care of.
Take care of, yes.
So now be the matter. But the issue now be say you don't already answer in the question we say are supposed to ask. We say you follow this matter we say we they talk about now. So as we talk on the console now, we can see almost all the question we are supposed to ask. Don't ask that way. But important one see day on for this matter. Now, even for Bodo Ibo for that side, we see say if you carry person now, see somebody not there fine, you go hospital. They don't fair quick tell you say you go take card. Oh yeah, go fill the form. As you fill the form finish, before they go put the person say don't have to take care of her. The first thing that they do first be say they'll first check the patient around. Whether the patient they are at risk. If it is at risk, they'll first see as or fit bring them down first. Before they tell you say this patient will talk about, so what will be your name? If you get documents, it will give us okay, see what they call out. But meanwhile, they'll first start that treatment first. But for this, your work now, this one they do for here now. How that fit the manage patient to be say don't get money?
Okay.
Or now your driver come and say, come. You get money, they say don't get, yeah, go outside. That's what they do am here.
Like you talk out. Now so they do am also for Nigeria. Usually called triage. Now two category of patients they get two category of patients, which is the stable patients and the patients with they for emergency. The ones with the emergency patients, we get what we call triage for them. After we don't triage them like that, give them that first aid care first before we come talk say okay, go pay for money for card, because now even for the card now you will even feel write anything. They call it documentation. They very important for this our work too. Why for those stable patients where they come as outpatients, where they just come just for treatment, they could definitely still pay for card. But as you talk yes, with the experience where patients will come, they not get money to pay. No, we know they drive there. As doctors, sometimes we they help too. As our power still reach, we will still support the one who will fit. But the one who will not still fit, you get to what they call psychological support. You will still carry them, sit down, follow them, discuss. Where your church, which church should they attend? Your family members, they're not the way your children. Call your children, come. Tell say doctor want see them. You want follow them talk. Like on Saturday, now I get one patient. The man now he come hospital with the try evaluate am for cancer of the prostate. So the man don't do many tests where they point to this cancer of the prostate. So when he come on Saturday, I come tell him I say still get one more test where you go do, which is the biopsy. Because this test, that's also amount it will cost. It will cost over 100,000. The man come open up to me say, all the one we don't even do sister borrow money into it in a church bus driver. So how you want to do this one? I can't go sit down with the man after where children, tell make you call the children, call the doctor wants sit there for hospital. Tell make you reach out to the church members who you know say they try, they get money. Then the family members to me reach out to them. So that's one also aspect who they help them, encourage them, know how they go fit it. We not just they abandon them inside. Now they will fit raise the money. Also, we still know some of all these foundations too. We they reach out to them at times, so we get patients like that. We not feel because they like some of all these foundations they now they support. They get their different sickness when are there for major. Some they now a foundation for cancer patients. Some they now a foundation for sickle cell patients. Just be like for this sickle cell center for Benin. Get some time last year where they reach out to me say get patients where he needs blood, they admission, you know they see money buy blood. I reach out to this Bisam Care Foundation where now this our Anthony General from Sosagi and get the foundation when he open out for a wife with died of breast cancer about 3 years ago. They come, they help the person, they give her money, drugs, make her fit buy blood and help her to at least see survive that treatment. So now what we do? If we not feel help them from our pockets, we go encourage them to know who they go fit call among their people, either for church or family member, or we will reach out to them of all these foundations to come assist them.
But when we talk, so if like say you don't carry enter the matter will be so first one as before. Because now when we talk about say how the fit they manage people you say not get money. Now, what if you use matter talk to us now? Now, when they talk about emergency, what if you say you need or you're sharp, make me do a sharp before something happen. Now, this person don't get money. So you the talk say now, say, well, I'll see the advisor first. And this person there under emergency will be the risk of say, if anything, any slightly this person will die.
Like
So this one that will see advisor first.
like I said, Tokam. We don't pick and whatever they Tokam. I say there are two kinds of patients. We get the stable outpatient, we get the emergency patient. That emergency patient, the very first thing first, and to give her triage, no say, okay, as a triage, now this kind of case, like what we will fit take for this hospital. Or no, this one pass us, this one are for tertiary centers like UBTH. Okay, Oga, we know if you handle this case here because of this. Carry and go UBTH. Or okay, if we are the one who don't triage and say, okay, I don't want to free handle. Then we'll give her first aid first. No say we don't settle am. No immediate cause of death there again. Then we'll come start to the talk of okay, how we want it. Because if you agree with me, we know if you just carry now, they treat everybody, they carry the medicine we will buy, till they treat everybody. When we finish, we don't see money to restock and buy another one. So, but then there's room for at least giving that first aid first. After we don't do that one first, then we'll come talk of okay, now who you fit call, where your wife, where your pikin, where your church member, where your family member. Let them know say you dey hospital, you need money. And so we take it do.
This one I did clear. Because this is why I ask the question again. I want to make you talk about this area. We be say I ask you now. Because that area is very, very important. Because of some rumors we be say we dey hear for outside say, doctor, in this hospital, this is the way doctor will take care of her. Doctor, you are abandon her, the next thing die. So with what you talk now, we say, I know they abandon patients. Because I know say, I guess some people too be say for this medical field, tell me say, they are more the two they first they teach you now.
Yes.
As soon as they pass through that medical line, we be say, for the go school. So another matter be say, as the governor now, which is Senator Mondo Bewolo, don't enter the area where we say concerning this health matter, and it don't say in an important place for our society, now with this health issue. I know she don't talk her before, so say you do well for nice things, maybe say you don't try create for us as a citizen of the state. But the matter be say, you think say you get the area where we say this same governor fit improve?
Okay, yes. Our governor, yes, we talking before, in the try where for the health sector. Because if you watch his body language as it concern the matter for health, you go know say na waiting in not to the play at all. If you anytime where our governor get opportunity to carry microphone talk, in the always talk of how he lose his sister to dirty water and poor health facility for village. And because of that one, can't say in ready to stand the leg for ground get it back. And sure say in overhaul the health sector for Edo State. And if you watch when our governor just take over, they were the very first day we just take over for office. The health commissioner and one person we just fair appoint because he know say he get better plan for health sector and he no one waste time to start to the execute am. I carry Dr. Siri Adams Oshomole to come be the commissioner for health for Edo State. And that one a person when they very young and get power for body well to work. And him a person wey still sabi the work of commissioner. Also, because for me, first of all, when you talk of say you want improve sector, now the thing is not enough to say you get plan. Governor now no go carry now, they go control the hospital management agency by itself. Now people wey carry come put for grant. Now it go matter whether they go fit deliver on this. And if you watch the kind of team where the governor don't build up for the health sector, now people will be like say they understand the thing, the health sector well. I don't talk about the health commissioner. If you still go to the hospital management agency, person where still appoint for there is Dr. Nelson Tenebi. Now person where don't even they manage hospitals for abroad, get hospitals where they manage for UK, before they carry and come. And if you watch where we're in now, they say come. So many successes we done the record for the hospital management agency. We be like when they even fair come talk and distractions before everywhere. But now with the way don't take the succeed, everybody don't come on mouth for him body. He don't move around all the general hospitals within the state to assess them, see how they do and know how they go fit take upgrade them, those facilities. Now, so like you dey talk about the areas where I feel say our governor or they need to improve. The Edo state government, now not be just the government, everybody within the health sector need to improve for the health sector. One of them, now the talk the concerns and now the state talk like now it be the upgrading of general hospitals for the state. It's not enough to talk say we don't upgrade our primary health care centers. Our general hospitals still need to be upgraded so that by the time that they refer patients from primary health care for village, you don't need to send patients from village come central hospital for Benin or come Edo for Benin or come UBH. Sometimes when they reach there, something don't happen. At least when they get secondary health care facility for these our villages, which is the general hospitals, where they go before from there they come to send them to tertiary hospital or come send them go UBTH. So that one are one area where I know say I want to make this our governor look into upgrading of general hospital facilities for the state. Then staffing, I talked about before, staffing. We need all these areas, all these hospitals, health centers, they need to get staff. If you go some health centers for village, you see only one person, now they there. Sometimes if na even community health extension worker, they'll tell you say they are doctor where they get, maybe na only 2 times a week they come because you still get another primary health care center where they still give them again when they cover, only in the cover like 3. So staffing na another one. They told one again, you get this emergency response where they work for Edo State currently. They call them Edo Emergency Service, Edo AMS. Now ambulance service, they're very active. Anywhere you dey for Edo State within the urban area, this Ego, Bubaoka and Oredo, you get emergency, you call them. No, they don't come. They get hospitals where they work with, they will carry the person, carry and go there. Now, very fantastic idea. But for me, I feel say this our governor go fit extend that, go the rural areas, all those Edo Central, outskirts of Edo South and Edo North, so that this thing will also dey function for those areas too. It will also help well because them join people who still really need this thing for those rural areas. Some rural areas, they will be like, say, even for the full village, people will get motor, they're not too many. But when this ambulance, they are accessible to this area, the people, they pick sick people, they help them, they go hospital. It will be of so much advantage. And the last thing, after what I still want me to our governor look into, now be the Edo Health Insurance Scheme. This one a scheme where be like, say, they help Edo State, they push Edo State towards universal health coverage, which means accessible and affordable health care. So this one an area where made them build on them. You get some of the drawbacks, challenges with these areas they face. Make them see how they go fit take build on them so that at least the states will try to get accessible and affordable health care. Another opportunity to also address our federal and state legislators. If you watch, this our brother will be deputy governor, when in the House of Rep, he registered over 10,000 of your people into the National Health Insurance Scheme. So if our state legislators they say, okay, they want to register their people from their different constituencies for the state, enter do health insurance scheme. You go see and say many people will come to benefit from this scheme. And so more people will be enrolled under them, and it will help us towards this our affordable and accessible health care we talk about.
My people don't be sporting though. We don't see say our doctor, you probably see your much go matter finish. This one really shows say you sabi your work. Because the matter be say, we know say government, we don't come see government, governor, do this work, do that. You know sure say it gets winning people too, we winning people. We be say the governor now, the government now they rule upon. You know sure say get part who supposed to play for inside this matter too. To still assist the government by themselves. Because me I know say for Obodo Ibo, it gets some organization too where be say it is supply things to hospital. Just to help governor, just to help the government. So they be say, we'll carry some pampers, so we'll carry some injection, so we'll carry some different things. Where individual at times will take support from hospital.
Yes.
You know, some areas they do say, we will be say, physically assist in government.
You be very, very correct. Health matter not being something will be only government on. Now, everybody own. When everybody will contribute to make sure say it succeed. Even those people where they stay for villages, they get their role to play. Government get a role to play. The big man where they stay for city get a role to play. The poor man, they get a role to play. If you remember when I started this talk, I talk say me na person where I get passion for public health enlightenment and programs, especially for our villages. So this now where that one where you talk even also come to play. No matter how they try now to even do many health centers, some places still they way they no go still get health facilities for there. That is where this health outreach program come into place. And that's something where if people they feel sponsor am for all those villages we know because I don't dey involved for this now for about 2-3 years. And I don't see and say truly many people they will get hypertension, they will get diabetes. They no go know. Now when they come there that day, they'll say, oh God, this your sugar high well. Go say no. For you come check out, you say you even get sore for leg. Well, not because of that sugar. Maybe that one even carry a call. You know say sugar is high. So that's why I go for you use this medium quick, take thank some of all those persons who don't support me to carry all those message of this health outreach, go villages. We don't go over 15 communities for this Edo state across the 3 senatorial districts. And I will tell you, say, we don't touch over 20 lives within this time. So quickly, I will thank our papa with the House of Rep, Chief Billy Osawa. We now one person will be like, say, we don't sponsor this outreach, go like 5 communities for a constituency for one day and Uriomo. Also, the very senior pastor for Omega Fire Ministry, Dr. Azeme Azen, and also person who don't still use me, carry this outreach, go some communities for a donut for there. I was last year, December, no, 2 years ago, December. Also, I felt talk just now, I said, this is our papa, something like you get foundation, Bisam Care Foundation, when they create for because of his wife, to remember a wife who died about 3 years ago from breast cancer. He don't use that foundation to take carry many health outreaches, go some villages where you know say they not get health care facilities. Also, you get on that foundation now where you just see they come up, they see they try too. Now be this Alpha Humanitarian Initiative Foundation. They also don't try. Then this our local government chairman too for Uhonde, Honorable Benjamin Reed. They are in a person too where is in that gidigba for this health outreach matter. Don't they try to ensure say all those communities, people wey know they fit get access to health care, they ensure say at least the message it take and go there, make sure say you see them, you treat them, both eye, everything, they make sure say they enter all those many communities. So those are areas where people need to invest in. As I talked about earlier, I said the wealthy, the poor, the government, everybody get a role to play. Although people where they village, when they bring this kind of program come, I don't notice them because I don't they involved. We'll carry on. You hear some of them, they talk, say, not be so fair come last year when you read it, they'll come say, we can't pay money. Fair go check. If not one would say pay money, if you get the one, say the money not too big, pay, receive the care because you don't know when that kind of opportunity will come again. If not free one, you consider for us, later you call, they say, I don't know, I don't know, say this one are free. I tell you like the one way fair come. So once you see that kind of opportunity for your doorstep, always jump at them, rush them, because you don't know when next that kind of opportunity will come again. So individual, government, everybody get a role to play for this health matter.
You do well. So as the matter be, we really thank you for this, what we say, use matter talk show. As our people will be say, concerned them to be the get hard for this health matter. My people, I don't say we don't talk to our doctor today. And the matter we will talk, and the matter will be say, if we say it will help everybody. Our doctor talk about say, don't be just only government or we ourselves still get help for inside this matter, make we take assist the government as well. And they don't make sure cease to say governor or the government of today that they don't say try their best to make sure say they improve this health issue. Because here and doctor that will say, they need to that and the issues, maybe the two that they do that still is inside, I can fix it testify say the present governor now, the governments now, that they try their best to make sure say things work for everybody. So my brother, you do well. And our honorable doctor as well. I don't add to that to today. Maybe for the big day.
Big.
So the matter be said, next time we will come talk about sickle cell.
Okay.
Because we know say a lot of people, they want to know about this thing. They don't know how still they function. Because we do say many for our children, they suffer this thing. But as the matter they go, because of time, now here we will foreclose to this matter we will talk now. My people, for everywhere we push that day, I beg people to stay tuned for the next topic we will call sickle cell anemia, how the matter they eat. So people that stay tuned, look for listening to that topic we will talk next time. We say you do well for the time we say that for us.
I do well
So we say you continue to sit down getting back and attend to this interview. But before we draw the matter close, or the curtain we say we put for back here, draw close, what make you still greet our people too? For the matter we say we discuss since we still greet our people.
People will do well. I still thank Urban TV where they city come. Don't they make sure so that they carry all this information to the go outside. Maybe people they know what they happen and also they are aware about their heads. But before I come out, what I want to leave now with today, now be say health now be wet. Not pursue money, forget your health. As you dey pursue money, carry your health along because na who dey healthy, na him dey fit pursue money. Thank you.
My people, we say, una do well. We must take that gidigba. Listen to this matter. Next time, we go see you again.